in the world of NGS test, what is more frequently used, and what are some things that people listening to this need to watch out for in terms of the words when they're used?
So let's start with a few definitions. I think you're right that it would be helpful for your listeners. So if you are a healthy patient, you could actually get a test in order to understand what are the odds that you're going to be developing cancer. And this type of tests are based on your germline or the DNA that you've been given at birth. And it is essentially called a hereditary cancer test. It tests, like most notably, I think Angelina Jolie made that test famous with BRCA testing, where she realized that she was at risk, and then she had a mastectomy based on the result of that test, because she knows that she was at risk for breast cancer. So that's germline testing. Now, if you think about the entire patient journey, which is a bit of an ironic term to use because it's only a journey that the patients want to be on, but you can actually do an early cancer detection test. Next, once you have a diagnosis of cancer, there is a variety of tests that you can test, that you can take. One is just do a biopsy of the cancer and test the tissue. And you're right that either you can try to do a very focused assay, even looking at maybe one gene, like EGFR, for example, and using PCR. You can do a small panel using next-gen sequencing. You're going to be testing maybe for a dozen genes, maybe for 50 genes. And people refer to that as a small NGS panel. And as you said, there is this comprehensive genome profiling test, CGP, that tests now typically for around 500 genes. And so that gives doctors a lot of therapeutic options in order to how to best target the type of cancers that you have. Now, in addition, you mentioned liquid biopsies, and you're right that if for some reason your tumor is very close to a blood vessel, or you're pretty frail and you cannot do a biopsy, you can actually just do a blood draw. And as it turns out, the tumor actually sheds DNA into the bloodstream, and as a result, you can actually sequence that DNA from the blood, identify it's come from the tumor, and try to find what are the mutations that are present there. So those are essentially somatic tests, and somatic as in you actually sequence the tumor itself. Now, to make things even more complicated, there is a new battery of tests that you can do to help manage the patient as that patient is getting treated. And so these tests are being referred to as monitoring tests, or sometimes MRD tests for minimal residual disease. And you can actually use these tests in a variety of different stages within the cancer patient journey, either before you give a therapy, so it's called neoadjuvant settings. You can test it after the therapy, so it's adjuvant testing. You can also try to use this test for surveillance, try to see if your cancer is coming back as an alternative to imaging with the MRI. So there is a number of tests and NGS tests that you can do right now, and a lot of them are gaining traction because, again, it gives doctors more therapeutic options in order to treat the cancer the best it can be.